Yes, we are. We are. Hi, everyone.
Hey, everybody. We missed you guys last week. So we are here today. The lift was amazing. Thank you to everyone that was able to make it to come out. It was a lot of fun. I definitely can't wait until next year so we can share more with you guys and work a little bit more at the online piece. But I'm telling you, Charlie Red and the Full Flavor Kings were amazing.
They were amazing.
We gave away so many bras, and it was really, really fun to see people in a safe space outside for the lift this year. So kudos to everyone that showed up. Kudos to everyone that joined us online on Facebook. Thank you so much to everyone that joined us online on Instagram. And yeah, so we're back. We will be here with you guys tonight, but next week, Friday, we will not be with you guys. No, we will not be with you guys. But we will be. We're gonna have some self-care going on.
Oh, yeah. We are.
Yeah, we'll have some self-care. We're going to take a little bit of a much-needed break. So I personally will be I've already kind of started dialing back my social media time, but we will be taking that back even more for myself. I probably won't see y'all until maybe like a week after. So thank you guys so much.
So today we're going to be talking about some holistic ways.
Chris. Thank you so much. Your granddaughter is one of the most beautiful little people, and your daughter was amazing. So thank you so much for coming on. We actually tonight are going to talk. I'm sorry I cut you off.
No, you're fine.
Miss Green started talking to me, and I got excited. And I was like, hey. But yeah, we're actually going to talk about some of the complex issues that we see. Those are our children.
Talking
and yelling through the grates. So if you hear them, they are having so much fun. But yeah, we're going to be talking about some of the complex issues that we see and how we manage them. I am going to go and talk to the children really quick.
Okay.
And I'm going to let you talk to the people.
So before this, I'll do the conception part.
Yes. Okay. I will let Dr. Crystal talk to you guys for just a minute.
So when we talk about holistic, what we're talking about is doing things naturally. Sometimes we'll say alternatively, but alternative really isn't a word that we like to always use because we don't really feel like it should be alternative. We feel like it should be something that is first line on being able to take care of people. But holistic is using natural methods, so supplements, self-care. We're talking about, being able to lifestyle management, diet management. These are things we're talking about that we use to say, how can we best prepare our bodies to conceive? And sometimes we don't think. Some people, we have an epidemic, and Montica probably knows this a little bit. People come to see me. They don't really come to see me to get pregnant, but some of one of the concerns is to be pregnant. So chiropractic care, a lot of times chiropractors can be very beneficial in using that for multiple reasons. So some of the things holistically, but it's just laying that foundation for conception. We want really to be the healthiest we can be before we conceive. There's so many things that can happen or that doesn't happen if we're not healthy. And health, of course, is one of those terms that we sometimes we think we're healthy and we're not, but we want optimum health.
We want optimum health because really when you're talking about, unfortunately, the state of our nation right now, the level for
Toxins.
Being health, just the level for health is so low. You know what I mean?
It's minimal.
It's
think like, are you alive? Oh,
yes,
you're healthy.
Then I'm healthy.
Yeah.
Or if you're not overweight, a lot of times you'll assume that because you're not overweight, then you're healthy. And a lot of times if you have, chronic allergies, if you're having trouble sleeping, if you have, different things, if you're having trouble, let's say losing weight, and those different types of things,
those don't feel good.
Yeah. If you're not pooping, which is one of the main questions that I ask a lot of my clients. A lot of people don't understand that you should at least poop once a day. But what ideally, just like with a baby or with a puppy, you know, when you get a new puppy or a baby, when you know that when they eat, that food is going to pass through, be digested, and come out, right? But with us, we're eating 3-4 meals a day and not pooping for days. That is...
I've had some patients that have not had a bowel movement in a week or two, and that gets really actually concerning because it can lead to other things that can actually be life-threatening up to a point. And we want to say why. And not only are you going to the bathroom, because some people say, well, I go to the bathroom 3-4 times a day, but it's not, but we look at the consistency of the stool. We don't literally look at it. We ask about it. But those are very important things. And so we look at these baseline of health for conception, and holistically we're looking at, holistic is looking at everything, the whole body. And we want that environment for the baby to be the best, because to be honest, we are already introducing them to toxins. I think a newborn baby has 200, 300 and something different toxins tested in their bloodstreams than compared to before. And so, or not even compared, that's what it is. And so we want to make sure, as the vessel that holds the baby, that we're as healthy as possible,
right?
And then it be able to conceive too,
right? Because you have to get there, right? So that's kind of whenever I am talking to a mom that is having trouble breastfeeding. So you can be having trouble breastfeeding, and it can be something structural going on with your baby. It could be something hormonal going on with you. There's so many different things that could be going on, And so one of the questions that I ask a lot of my moms, are, did you have trouble, conceiving? Because if there's some issues going on there, that is a red flag to me. Well, okay, so she had trouble with this. We need to figure out, what was going on there hormonally, because all of that, it all plays a part and runs together. One of the
most common things that Montica and I see, and in women a lot, it's very common, at least from women that we see, is PCOS. And it's really interesting. A lot of women haven't even been diagnosed with PCOS. They haven't been able to conceive in multiple years. There's other things, and they fit the profile of someone, they have it. And then also looking at thyroid disorders. Yeah, so those are two things that I see quite a bit that affect women, and it will affect you being able to get pregnant or not.
And the thing too, what I love about what me and Dr. Crystal are able to do is that we're gonna talk to you about these things, but a lot of these things can be addressed with making some changes to your diet. We can look at your nutrients. Dr. Crystal can run labs. We can find out exactly what is going on. And a lot of times the labs that Dr. Crystal and what she's going to be looking at is going to be different than what your traditional Western medical doctor is going to take a look at. So even, when we're talking about things that are going to set us apart and that are going to make us different, Dr. Crystal is a chiropractor. But she is also a nurse. She's done functional medicine. She does functional nutrition. And those things really set her apart from other, I would say, traditional
sometimes traditional chiros, and then just traditional healthcare in general. A lot of times in the Western model, when I say Western United States, is a lot of times we look at bits and pieces. Oh, my arm hurts. Let me look at your arm. Oh, my leg hurts. Let me look at your leg. We don't look at it all connected. Oh, I can't get pregnant. Let me look at your uterus, which is important.
Right.
And I'm being a little bit dramatic, but why aren't we looking at other things, right? And so what it gets missed a lot. I'll have people say, well, my doctor said all of my labs were fine, and I look at their labs and they drew labs, just a basic chem panel, and they're not, and then some cholesterol. They're not looking at further like inflammatory markers. We're not looking at thyroid markers. We're not looking at all these other things. There's so much advanced testing that's available. You can look at how much nutrient levels your cells are having, from vitamin D to a lot of other vitamins and minerals to omegas, And so it's huge. And though these are things that can prevent us from conceiving, and then it can prevent us from having a healthy pregnancy as well.
And your trace minerals, your iodine levels are really big as far as, when we're talking about being able to make milk and those different types of things. So we want to look, at all of those things and really see, what is going on, with you, so we can get a complete picture. I know a lot of times with a lot of my clients, we'll be treating one thing, trying to help her get some milk. And then the next thing we know, that something else that she's been dealing with chronically for many years will miraculously, clear up. And it's, when you're talking about your body as a whole, if one thing isn't working, it can be something else. So even when you're talking about like muscle strain, because, I do body work, it may be something that is, it might be your hip, but your hip might be the reason that your neck is hurting. You know what I mean? Because of the way that you're walking or the way that you compensate and those different types of things. So really getting, a complete picture of what's going on with the body is what myself and Dr. Crystal will do. So if you were to come in to see either of us, that is what we're going to do. It's not going to be a 30-minute visit, really quick the first time. It takes, by the time I get a good complete history on my mom, start to finish, and especially if she's had other children, and finding out exactly how those experiences have been, finding out, a lot of people don't realize, if I ask you about your periods and when you started, have you been on birth control? If you tell me, oh, well, my doctor started me on birth control when I was, 13 because I had irregular periods. If you had irregular periods, then there was a reason for that, right?
Correct.
You shouldn't need something to make you regulate,
and
your
something like
periods.
birth control is a false sense of regulation. It doesn't. It is really just hiding what's really going on, and it's masking it. But it's not only masking it. To be honest, some birth control will actually make things worse.
Yes, and it can be damaging. So those are the types of things too, that when we do see these things, we're going to talk to you about rebuilding, and replenishing your system, rebuilding your gut. A lot of times people will, and I feel like I have to, give a shout out to Jennifer Tao, because that was something that she always says, you can't just throw probiotics at something. You have to heal the gut. You can't take, if a lot of people will do an elimination diet and take things out, but you don't do anything, you don't do any type of gut healing. And so then you start reacting to all these other things. It has to be a complete piece.
And I would say, in general, we can treat most people holistically. And this is men, women, babies, all. But we're focusing now, of course, on women, the people who conceive and get pregnant and breastfeed.
That's what we're talking about tonight. Which is why we're on the lactation page. So I want is, yes, we do it all. But tonight our focus is going to be for moms and babies. And that's,
because it is a part of all of it. I mean, all of us came from a mom, right?
It's my favorite.
It is her favorite.
It's my favorite.
She kind of has a business.
I do. I love it.
And I will say that since I've been working with Montica, little babies, it's just fun to be around little babies.
Oh my God. I love babies and mamas. They just,
they
make my heart sing. So it's a good thing. And it's really important. One of the things we were talking about earlier today, we were talking about trauma and different things that people have been through. And
trauma
I was just talking
many
about,
different things.
oh my goodness. Many of you have heard my story as far as, my oldest daughter, but I had a colicky baby. And I will tell you that talking about that time in my life,
we should do that.
We should. It's still, I don't know if we should, but it's still like, it literally chokes me up just to like think about it, because it is so hard. It's so hard to deal with someone that it's not even her cry, is what I was telling Dr. Crystal. It's not her cry. She used to scream because she was in so much pain. She would scream and she would scream.
And I think the other hard part too is that we were talking about this is what's interesting is now Montica would know exactly what to do. I would know how to help. We would know where to find help if we couldn't help, because that is not normal. It is something that's signaling something's going on with the baby, but we know what to do with it now.
Right.
We know what to do about it
and how we can help.
And how we can help.
Because what I got at that time was, well, you just have a colicky baby. It's okay, to put your baby down and to walk into the other room, which, yes, that's true, right? Because we don't want any baby getting abused. We don't want any, one shaking a baby. And that's where a lot of these things come from. But that trigger is because it is so hard, but as a woman, laying your baby down and walking away goes against everything biologically that we are wired to do. We're wired to protect. We're wired to help. We want to help these babies. So then you lay it down and you walk away. I see so much more postpartum anxiety, postpartum depression in moms that have these colicky babies because you can't help. And it's so hard when
if
people
you've never had a colicky
answers.
baby, you don't know. And I mean,
No,
this is I'm going to put this in
unreal.
context. Montica is upset about it, and what's interesting is her daughter's 14 years old. So this is not like a baby she had 2 years ago. This is something that still is traumatizing.
Oh yeah.
To think about, and it was, over a decade ago. And so this is real stuff. And I know lots of women who have had the same experience, and it is not, it's easy for someone to say, oh, it's just whatever. But if you haven't experienced, it's not really fair for you to say that.
Yeah. So, I mean, definitely if you are experiencing, anything like that, and I'm not saying that, we can help every case. That is not, no healthcare professional can make that blanket promise. But I can tell you that I have worked with so many babies that have colic symptoms and families that are dealing with that and been able to help them. And I think, I will always say that, God takes things that have been negative and turns them around into something good. And I believe that I am as passionate about this as I am because I understand it. I went through it. And it's something that I have purposed to learn about and to learn how to help these women that are going through the same thing that I went through, when you have no one that is really giving you any help. I mean, I know we've talked even about, so that's colic, but a lot of times with colic, food allergies run right along with that, because the colic really is pain in the gut. So these babies, like they stick their legs out straight, they scream because they have this like burning sensation in their stomach. Well, they have all this inflammation in their little bellies, and it hurts really, really bad.
And they don't know what to do. They are just gonna
right, and they're just trying to get help, right? But as a mom, you don't know how to help them, and if no one is addressing gut health in adults, most likely no one is going to address gut health in an infant. But it is still a very real thing, even in these babies, and they're showing us that they're having pain. They have this gas that mom's like, well, I'm giving them gripe water and I'm using the Wendy and I'm doing all of these things, and none of it is working. My baby is still crying, my baby is still miserable, and they'll have eczema and all these different types of things. My oldest had eczema. She had a spot on the back of her neck that she would scratch until it would bleed. So it was and
that is something too. I mean, we talk about all these symptoms. A lot of it can be related back to gut health.
Right.
Allergies, eczema, and I've had patients with psoriatic arthritis or psoriasis. And even though it's not maybe only a gut health issue, that a lot of times when you clean up the gut and you really truly heal it, and this is not an overnight process, unfortunately.
It's not something that we have like a pill for. It is a lot of times this lifestyle changes, but they're not horrible lifestyle changes. No, and when you start to make them, you feel so much better. It's like, I didn't know that I could feel this good. With eczema, just kind of side caveat with that, for my daughter at the time, again, this was 14 years ago, no one addressed the reason that she had eczema. It was, here's this steroid cream rub this on there.
Well, then we didn't even talk about gut health. No. Well, when I say we, so chiropractors, we talked about gut health a long time ago. But, you know, we won't talk about how, that a lot of times, because the way we're thought of, it's not really...
Right.
Our information doesn't seem to be valid, and then 10 years later you're like, oh, well, yeah, maybe it was, but then now other people get credit for it, or we don't even give credit, we just know that that's the truth, like with fish oil or omega-3s, gut health, all of those things.
Yeah.
And so,
but when you're talking about eczema and food allergies, eczema is caused, it's an allergic reaction to something.
It's an inflammatory response.
So you can't just rub something on it and expect it to go away. You can soothe it. There's something causing it. Exactly.
So that's something that sets us apart is when one of the words that you used I like is complete.
Yes.
So when we look at something, and I've seen Montica evaluate babies and do this, it's like you take in this information, but you are building this picture of everything that could be going on, because there's, like I said, baby comes in, I can't eat. Oh, well, let's just feed it. Let's just change its formula. Oh, let's just do this. Well, that's not really addressing the real issue and the real problem. So when we're putting this complete history, this complete picture together, we're not going to have all the pieces, but that's the goal, is to put this complete. Then we can really find out why, the real cause of what is the issue, and then we can address it. Because if you just put a Band-Aid per se over it, it doesn't really, it might help for the time being, but it doesn't really help. It's almost like, and I know this might be a cliche example, but if I stick a knife in my leg and you stop the bleeding by just putting things around it, okay, that might stop the bleeding for a minute, but you got to get the knife out. Right. Or you're not going to have the healing. It's not going to do what it's supposed to do. You're not going to be able to walk again, whatever it is. Right.
And a lot of the things that I've seen, I was a nurse in the hospital for a long time. And what I've seen is that now being out of the hospital and being in a private practice setting, it is so different to see the differences in changing the gut and addressing nutrients. And changing what babies and moms are eating and all of those things versus giving these infants, pharmaceuticals that are not even labeled, for them. So, my favorite, or it's not, I shouldn't say favorite, but one of the ones that I saw a lot was the ranitidine. So we would give...
Tell them what ranitidine is.
Ranitidine, I just completely blanked when you just asked me what that was.
So it's a reflux. When babies have reflux. Yes.
Yeah, but what's the...
Pepsid.
No, it's not Pepsid.
It's not. Zantac.
No, it's not that either. Oh.
Wait, what's the...
It's not, I can't think of it. It's one of
those. I can't think of it.
I can't think of it. I'm going to think of it before it's going to come to me.
Prilosec?
Nope, that's not it either.
Look, how many different gut...
There's a lot of them.
How many different reflex medications?
There's a lot of them.
This means there's a
It might be Zantac.
I think it's Zantac.
I think it is Zantac. But I'm not 100% sure, so don't quote me. I'm going to think about it.
I could look it up on my phone.
We could, but we're taping on our phones. Look it up on that one. But
we're not going to talk about how many
we'll give these babies that, right, to help with the reflux, to help with the spitting up, and what those things do. You are decreasing the acid in these babies' stomach, but we need that, right, to be able to digest. So giving them these things, what are we doing to that baby's gut health for going forward?
And actually what we found is it's Zantac.
Oh, good job.
So actually what we found too is like someone taking a PPI, which is a proton pump inhibitor, is that it will actually change your gut health. It makes it to where the good bacteria aren't thriving. So a lot of these medications are doing a lot more damage than we think that we're doing. Now they're not saying don't take medications. There's a need for medications at the appropriate time.
And sometimes it is, but when we're talking about Zantac specifically, that is one that when I found out that they pulled the I'm pretty sure this is it. They pulled it because it was cancer causing, but it was cancer causing in adults. And so they recalled it. And if you look it up, it's there. It was FDA recalled it. But if it's causing cancer in adults, like what is that doing to
little bitty babies
to a little bitty
whose
baby?
cell turnover is so fast, and so because they're developing and growing, and they're so
and there's so many other things that we can do that work to help these little ones, because we want to set them up like it's the beginning. These are the building blocks, and you want to, now all these new studies are coming out about, your gut being your second brain and different things like that when we're talking about Alzheimer's and dementia and all of these different types of things. When you destroy the gut at such a young age, you know what I mean? You are setting people up for, having trouble, for the rest of their lives and when they become adults, So now when you look at most of the commercials that you see on television are for, irritable bowel syndrome, irritable bowel with constipation, irritable bowel with diarrhea. You'll see, when I was younger, it was always Tums commercials and Pepto-Bismol commercials and all these different things of our guts literally trying to tell us, hey, I don't like that. But so that you can continue to eat that or eat that in that way or stay in that stressful state or eat that, whatever it is, I'm going to take this so I don't feel it. But just because you don't feel it does not mean that the damage isn't still happening. So it can be destroying your gut and you're feeling that, but then you take something and it's still creating a problem. Yes. So we want to help moms, help babies, help adults, men,
it's
everybody.
It's all the cycle because, of course, when we're talking about conception, so we're talking about...
I don't know. We're talking about making babies.
We're talking about conception and the moms, but these moms are having boy babies, girl babies, and these babies grow up to be adults. And so, what we found with epigenetics, too, I mean, that is important. Conception, that epigenetics is just saying that the genetic influence and what affects that baby can be found up to, I don't even know how many generations. I used to say 3, it's even more than that. So meaning like my great-great-great-great-great-grandchildren can be affected by how I take care of myself and my health. Some things I can't control, I understand that, but it just trickles down.
Right.
So it's very important. So even though we're talking specifically about conception and pregnancy and breastfeeding, this is really talking about everyone's health. Right. Because of those things. So we're talking about holistic pregnancy, maintaining that. You see women who are pregnant, right? Because they're going to have the baby, and then a lot of times they'll have Montica want to evaluate the baby to make sure that they have established a great breastfeeding relationship.
But you even skip like the whole pregnancy stuff. So you can have trouble conceiving,
yes.
But if you're having trouble conceiving because your periods were never regular and you started, you know what I mean? We want to figure that out.
How do you maintain a pregnancy?
Right. How do you maintain that pregnancy healthfully? And then the nutrients, what are you taking in? Because we have talked about MTHFR very briefly, and we will not go down that rabbit hole. But when we're talking about getting the methylated folate and those different types of things, making sure that you have those precursors, again, pre-pregnancy, right? So I will always, try and remind everyone that most of the time we don't know that we're pregnant until we've already been pregnant, for 4 weeks.
At least.
And so much development has already taken place in that baby within that first 4 weeks of life. So you really want to go into pregnancy not being depleted.
And if you're depleted, the baby is depleted.
Right.
And the baby will deplete you. So in the mother baby when you're pregnant, that baby comes first in the body's mind. So a lot of these things is you will become further depleted. And the baby will get all what you have.
And
it
baby
still may
comes
not be
first
enough.
To an extent. Because if your body can't,
then it won't. Yes.
Then your chances of not completing that pregnancy, that can also, be something that takes place as well. So we want to have a mom that's going into pregnancy with enough, nutrients and healthy enough to be able to get pregnant and then maintain that pregnancy. Yes. Other things that I look at with moms, it's has your breast size increased, and those different types of things, because those are things that that should happen, during pregnancy. And a
And
lot of
that's
times
why-
those are questions that aren't asked, to moms that are planning to breastfeed. But
Yes.
your breast size should increase. And if we don't see any, I'm not saying that you got to be huge, because I've seen small breasts make so much milk. And I've seen small breasts make a whole lot of milk, and I've seen big breasts not make any milk at all. So that's not really a...
Would you say that the pregnant moms that you see have a difference in some of those things by what kind of practitioner they're seeing? Like if they see a midwife, or if they see a more holistic minded MD or DO, or a nurse practitioner, or if they see a very
Unfortunately,
medical...
I feel like breast size isn't something that I hear. I mean, for all of you guys out there,
this is specifically for breastfeeding.
I'm wondering, I'm curious, because I know that I ask my clients, but how many of y'all out there had your OB or your midwife, ask you, if you know that you're planning on breastfeeding, did you have any breast size increase, or I know that they do checks to make sure, that you don't have any, cancerous, lumps and things like that. They'll check for that. But were they really concerned about, did you have any breast size increase? So that would be a question.
I was never asked that.
Yeah, I was never asked that either. So, and then the folks that I asked,
I don't remember.
I don't know of them being asked. So those are things that I'm going to look at.
Because they measure, so I know they measure, of course, the girth of the abdomen when the baby is growing, to kind of see if you're going along. But I've never really thought about, I mean, my, your breast tissue typically gets bigger, and if they don't, you notice that. But I've never even thought about.
You notice it, but even a mom,
but
a mom doesn't know. Yeah, because if you've never been pregnant before, your normal is your normal.
Yep.
So if you don't know that it should, then you're just gonna assume, because that's what we think, right? We just think that breastfeeding is gonna work because that's technically what we're made to do, but that's not always the case. Right. So again, like I said, you can go through an entire pregnancy, and then you're thinking you're just gonna put this baby to breast, and it's gonna suck, and it's gonna gain weight, and it's gonna do all of the things, and then all of these different things start happening, right? And so what I focus on at my office is complex breastfeeding issues.
So what does that mean?
So if you've never asked with any of my 6 pregnancies, Mercy, yeah. So Amy was saying that she never was asked, and she had 6 pregnancies in a mix of OBGYNs and midwives. So I feel like that is pretty much the norm. But those are the things, that's something that, is definitely an important thing. If you're a new mom, or if you're, currently pregnant, pay attention to those things, because that can be, a sign as to if you're going to need a little bit more support, or if you're not. And if you're not seeing that, those are things that we can start to work on, while you are pregnant. You can get an appointment. You can come talk to me. There's different herbs or different things that we can do, that will increase increase mammary tissue, or that have been proven to, and it's all dependent upon, your body, and there may be some other things that we need to do. And again, like I said, there is no magic bullet, and this definitely several things. And I tell all my clients when I first talk to them, I'm not your average IBCLC. So if you're gonna come and see me, that it's gonna be work, and I'm gonna ask you to work, but I'm gonna work with you, and I'm gonna give you the tools that you need, and I'm gonna be with you, the entire time, and help you to do the things that you need to do to be able to be successful in the way that is going to be best for your family, because your level of success, or what you think you want, is going to be different.
The goals are different
for every single family. But I do think
that's something to think about that we don't think about, is when we talk about the breastfeeding relationship, and even on the holistic level, like is what we're talking about, is we think that, that starts when the baby's born. Is my colostrum coming in? Is my milk coming? Or maybe a few days before the baby's born. But what Montica is saying, no, it starts before. We need to pay attention. And what I'm saying is what it starts before. Our overall health, and we can talk about specifics with that, our overall health, but then asking these good questions and saying, these are questions to look at breast size and how much, breast tissue is growing, because
and
they can be indicators
more
of other
before
things.
than just before pregnancy. Because if you notice that, if you have been diagnosed with PCOS, let's say, or if you have, wide space breast, and wide space means, you have a lot of chest area, not a lot of cleavage, just, a whole lot of chest, the tubular shaped breast, those different types of things, those are going to be a concern for, possibly having some insufficient glandular tissue. And if you have insufficient glandular tissue, then that's going to affect your ability to be able to make milk later.
Nobody talks about that. Nobody talks about, we talk about on some levels, we know as adults, just general, there's different shapes and sizes, but that how that plays into, preparing, but all it is, it's not like one's wrong or right. It's just saying, okay, what information do I need to prepare myself to have a successful breastfeeding relationship as I move forward? But these are questions nobody is asking, nobody is talking about until you have a problem. And at that point, what I've seen, and maybe what you've seen, they may see you before, but I've seen a lot of people give up, and then because they didn't get the information, they didn't know this, they didn't establish a great breastfeeding relationship or a good one. They give up, and sometimes they're advised to give up.
Yes,
and then they go back.
That a lot.
And then you talk to someone like Montica or another IBCLC or anyone that is even, but Montica is great. Is like, oh, that was a simple solution or a simple process of figuring out how to help that instead of just giving up. And then the mom feels defeated, because I've talked to moms who are like, I wish I would have known that.
Right. And I'll say, even with, when we're talking about these types of things, it's when you are going through school to become an IBCLC, yes, we can recognize insufficient glandular tissue, and a lot of OBs can recognize it. But then if you do see it or recognize it, it's a hard stop. Oh, well, you have insufficient glandular tissue, you're not going to be able to breastfeed. So you need to be prepared to do formula, but then there's a reason too, right? That
we dig a little deeper.
Yeah. So there's a reason that you have insufficient glandular tissue. So let's figure that out. Let's figure out why hormonally these things didn't take place, and what other symptoms do you have possibly that are going on with that. And we can look at your hormones. We can look at these different things, and try to help you to get, because even with having insufficient, you may not be able to completely feed your baby with your milk. Well, and that may be the case, but you may be able to make enough to give your baby some breast milk, and some breast milk is better than no breast milk. You may be able to breastfeed at the breast with a supplementer, and there's different types of supplementers. Some supplementers are big and bulky and uncomfortable.
So a supplementer is something that's attached to the breast so the baby can suckle the breast while getting mother's milk, but also getting an extra addition formula or something too.
Right. Yeah. You can do formula or donor milk or make your own. There's all kinds of different options, and those are also things that we could help you, navigate and those types of things.
So this
but you
is
can
the
still
lift.
have your baby at the breast.
Yes, so this is the lift that Montica just, put on, and then all of these other things that there are resources for all of these. So we want to say holistic. There's an answer. We can't always find you all the answers all the time, but there's a lot more simple answers than we sometimes think that there are. Right.
And just because you have a hormonal issue, it could be, I've had some moms that get to between 2 and 4 months, and they'll say, oh, well, my milk just dried up and I didn't have enough milk for my baby. Well, that shouldn't happen, right? Your milk doesn't just dry up. There's a reason for your milk to dry up. Yes, it could be hormones, and I've had, different IBCLCs say, oh, well, it's hormonal, so, you're not going to be able to do it, so you need to start giving formula. But it could also be structural. But if it's hormonal, that's something that we can work on. You know what I mean? That doesn't mean that that's the end all.
And the difference with Montica, talking about it, structural hormonal. Hormonal, something's going on the inside physiologically that's going on. Structural, she's talking about the shape of the breast, the shape of the baby's mouth.
Yes.
How the
tongue ties.
So it's actually little physical, structural.
Jaws, different things like that. If they have, anything going on with their palate. What did you say, Miss Chris? Who's that?
So those are the different things, but these are things like you don't have to know all the answers. Obviously, if you're not in our area, if we don't know the answers, then we can find them for you. We can shift it, or shift you to somebody else that does. But a lot of these things that I wonder if you could scroll up a little bit, it would do it. Okay. A lot of these things that we're talking about will, we have some answers to, we have some help for you. And we're not using medications. I was talking about when you had left a little bit, but alternative, which we don't like to always say is alternative. We like to say, because it shouldn't be alternative.
It shouldn't be alternative. Mm-hmm. It's to me, it's really sad that when you're talking about midwifery care or lactation care, that those things are considered alternative.
They should be primary.
Because it's not. You're absolutely right. Being holistic and looking at people from a holistic standpoint is really, I feel like we're turning towards that way as a nation, because people are sick and tired of being sick and tired, right? You hear that, but that is real life. And so, again, coming to see myself, coming to see Dr. Crystal, those are, when you come and see us, we're here to find out what is the root cause.
We're committed to finding the real reason why it's not working.
Right. And that is, again, male, women. I don't see men, but Dr. Crystal does.
I don't really turn anybody away.
No, Dr. Crystal she does funky. She sees everybody. But again, like I said, we're focused on women and children tonight.
I thought you almost said she does something funky. But
no,
you're saying functional medicine.
Functional. Let me finish my complete sentence. Functional medicine. So we would love to see you guys. We wanted to come on tonight and just kind of give you guys a little bit of, why our visits are different. I have people say, oh, well, why do you need 2 hours? Or why does Dr. Crystal need a full hour? Because or more, because you're not just going in to get an adjustment. Yes, if Dr. Crystal feels like you're going to need to be adjusted, then she's going to do that. But I've seen Dr. Crystal work, and she will talk to you about, movement, your diet, labs, all of the things, and she'll adjust you. And so she's going to be with you for so much more time and be doing so many more things, with you in that visit. So, being a health and wellness coach, being an herbalist, being an IBCLC, being a nurse, being a chiropractor, being a nurse, we have so many things that we have, studied and done, graduate studies in, and put those things together, and postgraduate.
Listen, we're talking about all the things we can do.
So,
oh look,
Donnie, yes, girl, you can get all of that. We can do that. But yes, we'll be self-caring, and I'm sure doing a little bit of,
this weekend.
Yes, I'm excited. So we just wanted to, come on and talk to you guys about, the package that we have put together for you guys, and we really truly feel like this is the best way to treat people, and we see great, excellent results. Our clients have great results. And we really want to help you find your best, so you can be the best for all the way around, because again, every family is different. I was a night shift nurse, and so somebody telling me, well, you need to do this at night and so on and so forth. I'm like, how in the world am I going to do that? So we have to be able to tailor things, around everybody's specific thing. There's no cookie cutter answer, and that's not what we're looking for, for you.
It is very personalized and very tailored.
Yes.
And then even to you, we come in and we'll talk about one thing, and we may have to change it up sometimes. So
always might have to.
It's our bodies are dynamic, and they're changing, and all of that.
Yep. So we are going to be getting our self-care on. Oh, Miss Chris said, if it hadn't been for you guys, my daughter would have given up. She couldn't completely feed her baby, but she continued to breastfeed for 18 months.
That's great.
And that's awesome. And
that's the things what we live for. We live for being able to provide hope and a service for somebody that really, we have the pleasure of doing it.
Yes.
And so, and making a difference. And I don't know, sometimes we don't think should be that hard, but unfortunately it is.
Yeah.
Like it is, it's hard to feel good and to live a quality life.
Oh, yeah. So, I'm looking at myself right now, and I got these
like you see me yawning.
I see you.
Listen.
So we're ready for our self-care, self-care week, and we are Gonna see you guys in 2 weeks. So not this Friday,
forgot. When you
but
were
the
sick,
Friday. The
like,
Friday
she's-
after next, we will be back with you guys with another topic, and we appreciate everyone.
We'll look refreshed then.
We will. We might need a vacation from our vacation, but I'm going to try to
maybe a girls'
try to
trip.
relax and check out.
Maybe
a
just
bit.
a girls' trip, because we always take vacations with families.
But I like my.
I do like them, but sometimes it's nice to do.
Yeah. Okay. So we'll see you guys.
All
We'll
right.
see y'all. Thank you so much for joining us. Everyone have a blessed and healthy
Labor
weekend.
Day.
Oh yeah,
Yes.
it's a long weekend too.
Yes.
Yes. Have a great holiday, everyone.
I don't know how to turn all this off. I'll finish.